There are a number of reasons why Americans pay more for healthcare. One of the reasons I want to explore is the poor choices some people make in relation to their health. Many Americans start their day with a nice bowl of these cereals. For example, the top three selling brands in 2017 are Cheerios, Honey Bunches of Oats, and Frosted Flakes. Per serving, these cereals are high in sugar and very low in fiber, fat, and protein. Frosted Flakes, for example, has almost 4 tablespoons of sugar in 1 cup of cereal. Honey Nut Cheerios has 2 and a bit teaspoons of sugar in 3/4 of a cup, and many young people start their day with these high in sugar cereals. And we have to consider what the impact of these choices will be on our health. Some of the risks involved in eating large amounts of sugar and refined carbs is the risk of type 2 diabetes, heart disease, weight gain. Many of these types of breakfast cereals are marketed to children, and it changes the way that they eat. The website Healthline said, quote, this exposure alters their eating behaviors and preferences for sweeter tastes, leading to an even higher risk of developing the aforementioned conditions, namely diabetes and heart disease. Now, there's some interesting data on some of the foods marketed to children in the United States. One study looked at 161 cereals, in which 46% were marketed to children. The breakfast cereals marketed to children were found to have greater energy, sugar, and sodium, but had less fiber and protein than those marketed to adults. The greater amount of those cereals, 66%, failed to meet nutritional standards, particularly in relation to the amount of sugar in those cereals. Another study looked at how different foods are sold to children on Saturday morning television. It begins by citing research by the Institute of Medicine of the National Academies that found food marketing influences children's food preferences, health, and consumption. During 27 hours of programming, there were 27% of the advertising was for breakfast cereals, and 91% of all advertising was for foods and beverages high in sugar, sodium, and fats. Many of the ads contained emotional appeals or healthy active lifestyles type messages. Children are being bombarded with messages and advertisements for foods that are not going to give them the best start to the day. With this in mind, one might say, how is it possible that these companies can sell products like that to children knowing they are not healthy? It is the reality that these businesses make products that people like, and children are susceptible to advertising messages and sugary foods. Is it moral to sell such products knowing the potential risk they pose? The answer, in my view, is yes. It is morally reasonable to sell such products. Why? It's important to remember that people have a choice in their lives. They have a choice for what they should put in their bodies or not. We have the marketed data. We know children are being bombarded with these messages for foods. That won't do them much good. And that is why it is essential. It is important to have an educated citizenry, so the citizens can make better choices in the marketplace. Each shelf will have a range of options to choose from, and not all of them are bad. Australia is a prime example of a people making good choices at the supermarket. They have the option to choose the high sugar cereals, as most other countries have, but the palate of the people is such that they reject to a greater degree the options high in sugar. Their choices provide greater health outcomes and don't set their children on a pathway of a preference for sugar in their diet. They make the choice for less sugary cereals, and the businesses respond by providing options that suit the taste and education level of the people. The people of the United States can make better choices at the market. That will lead to a reduced healthcare cost and better outcomes for students. And the market will respond to a change in the demand and the desires of the people. We cannot forget that in this system. The market and businesses respond to what the people want. And if people make the decision to reject sugary cereals, then businesses that want to make money, that want to provide a service, that want to give us a good start in the morning, will create products that reflect the needs and wants of the people, the same way that happens in Australia. I want to provide a contrast to one of the favorite breakfast cereals in Australia, Weet-Bix. Weet-Bix is a simple cereal enjoyed by many Australians, and it's very low in sugar. In many conversations I've had with people here, they express a desire for more savory foods rather than sweet. Instead of sugary preserves, Australians enjoy Vegemite on their toast. In many ways, Australians start their day off with less sugar than Americans do. which would lead to a decrease in preference for sugary foods in life. I reckon the sugary hole that captures many American youth does not happen in Australia to the same degree. Let's look at some studies to show the difference between making better choices for just breakfast alone on academic performance. One simple study gave children a serving of oatmeal, which is higher in fiber and protein compared to a typical sugary style cereal. The difference between the two is the glycemic index, which is the rate in which the carbohydrates in a meal are converted to fuel. Basically, if a meal has high glycemic index load, it will convert quickly, leading to a crash. A bowl of oatmeal has lower glycemic index, which is a better breakfast option. When researchers gave children these two cereal options with simple academic tasks like memorizing the names of countries, they found that children having oatmeal versus Captain Crunch did 20% better on these tasks. We all know the merits of better educational outcomes, but I wonder if we put enough thought into the type of fuel we are providing to children in America. We tell them to go to school, we force them, in fact, up to 16 to go to school, yet we feed them food that won't give them the best chance to be successful at that school. We don't give them the food that will give them the best chance that they can at getting a proper education. Now, I'm not laying all the blame for Americans' poor health outcomes to breakfast cereal alone, of course not. There are some serious cultural issues to address in relation to the choices people make. There's a video going around of a young girl at a sporting game that is downing fairy floss, or candy cane as it is called in the US. You can see the sugar working on her as her eyes go wide, and her reaction is as though she is getting a hit from a drug. And that is exactly what is happening. The response seems to be that this video in particular is cute or funny, but I find it troubling as she's literally getting a hit of a drug at a very young age, and you can see the response on her face. We can further see that it is no laughing matter when we look at the rates of diabetes in the United States. The numbers are staggering. A report from the Centers for Disease Control and Prevention, or CDC, said, quote, more than 100 million U.S. adults are living with diabetes or prediabetes. The report finds that as of 2015, 30.3 million Americans, 9.4% of the population, have diabetes. Another 84.1 million have prediabetes, a condition that, if not treated, often leads to type 2 diabetes within 5 years. The total estimated cost of diabetes in America is $327 billion, with 1 in every 4 healthcare dollars going to treat diabetes. People with diabetes pay around $16,700 on average in medical costs in a year. Not all of these costs are avoidable, but many of them are. We need to consider what is possible if Americans took better care of themselves. Billions of dollars of savings are on the line here. If the United States wants to spend less on health care, one way to reduce costs is to make better choices at the supermarket. All the information we have is available on the boxes. The nutrition labels are there, and Americans would reap the rewards of making better choices. The kids may complain, it may not be sweet enough, but it is a sacrifice that will lead to better health outcomes for many people across America. It will lead to a reduced cost in health care. Now, it is easy for the Democrats, in particular Bernie Sanders, to make the claim that healthcare is so expensive because of greedy drug companies and hospitals, and to an extent that is true. There is greed that happens. There are many companies making exorbitant amounts of money off the poor health of the people. But if we consider the issue more deeply, it does us little good to lay the blame on everyone else, including the government. I don't believe they have the responsibility nor the power to make sure citizens are healthy. Fundamentally, it is our responsibility. People should be free to deal with their own health problems and to address the issues by getting educated about lifestyle and diet. Our health is our own responsibility, and if we educate ourselves, we will make better decisions. Australia is often used as an example of a nation that has successfully implemented universal health care. But what we should really be looking at is the choices the people make, leading them to be a healthier nation overall. A better step will be to see the choices they are making at the supermarket, for example. Let's look at the humble breakfast cereal Weet-Bix and consider how the United States can make better choices in what we put into our bodies. I focused on breakfast cereals, but let us not forget, all the other things leading to costly healthcare in the United States, including obesity, alcohol and smoking, fast food, and sugary drinks. We need to take responsibility for our own health and our own well being, and I'm certain if we do, we'll find ourselves paying less for healthcare in the United States. It is but one additional measure that we can do to lower the cost of healthcare in the United States, which is one of the goals to make it more affordable, to make it more accessible, and to make it better quality. And it is possible if we make better decisions, if we get educated, if we embrace our own future, if we embrace the responsibility that we have over ourselves to be healthier, which will make us happier, and we'll have a better healthcare system.